I see. Hey guys, wishing you a blessed afternoon. Real quick, I'd like to borrow your minds for just a moment, okay? Shut your eyes if you have to. I'm going to paint you a real nice picture. So picture yourself, you're at work, you're on your rotations, and let's see, you're counting by fives, or you're shaking up that amoxicillin suspension, you're adding that Tutti Frutti bubblegum in it, and a patient walks up to your counter, and they ask you, how much is that flu shot? Or how much is the pneumonia shot? And you can listen closely, you can almost hear their heart drop as you tell them the price of it. Now, let's see, as healthcare providers, it poses a problem. They're not purchasing a candy bar, they're not purchasing that new DVD. They're inquiring about their health. And the only thing that's preventing them from getting that health is price. Now, we have a solution to that problem. The answer is Vaxicaid. Now, in short, Vaxicaid is a program we've constructed to immunize the elderly that demonstrate financial need. Now, real quick, I'd like to introduce you to the intricate parts of our well-oiled machine that got this program off the ground. We've got Jordan Carroll, we've got Malia Clark, we've got Jasmine Johnson, Vivi Tran, Patricia Brantley, Talia Shahid, Javier Martinez, Devin Paul, Alex Perryman, Brianna Lee, Danielle Black, and myself, Roger Crawford.
All right, the mission of Vaxicaid is to preserve the health, promote wellness, improve quality of life, and to educate the underserved elderly population 60 years and older, and through administration of influenza and pneumonia vaccination.
The vision of Vaxicaid is to be a patient-centered health program by providing extraordinary care and superior service with convenient access.
Here at Vaxicaid, we came up with the acronym SHOT, and that stands for to serve, help, offer, and teach the elderly population who needs vaccination. The index is just a general overview of what we like to accomplish with Vaxicaid. We like to locate the underserved and reach out to them, network with other healthcare professionals such as practitioners, other pharmacists, nurses, etc., maintain communication with pharmaceutical companies and manufacturers of vaccinations, establishment of clinical facilities where we would like to actually administer the vaccinations, assembling teams of well-trained associates and volunteers in the community who would like to help out, and other pharmacy students, and develop assessments that will evaluate the effectiveness of Vaxicaid to make sure that our program is running properly.
Currently, there are no local programs that work to help the elderly and uninsured completely cover costs for vaccinations in our community. According to vaccines.gov, patients that are looking for financial assistance are asked to wait for the enrollment period to sign up for insurance through the government healthcare website. There are many pharmacies and insurance companies that offer these vaccinations at discounted prices. Unfortunately, some lack the financial stability to cover the cost of premiums, and there are about 5,700 people that cannot afford the vaccination, even at the discounted price. This problem is being addressed in other communities. For example, the Los Angeles County Department of Public Health offers flu vaccines at no charge to people who don't have health insurance or whose health care provider does not offer flu vaccines. Also, in the state of Massachusetts, they offer a flu outreach program for health clinics and local community programs to give flu shots to anyone that is in need and will completely reimburse them.
Okay, conducting our needs-based assessment, we noticed that in our community, this program affects elderly patients 60 and older who can't afford to get proper vaccinations such as pneumonia and influenza. On average, there's here in Okaloosa County, there's 200,000 people residing here. 14.7% of the population identifies as 65 years of age and older, and roughly 20% of them are considered having low income. According to the census of 2010, influenza and pneumonia ranked among the top 10 causes of death for Okaloosa County. 35.3% of the elderly population in Okaloosa County reported never having an influenza vaccination, and 42% reported never having pneumonia vaccination. So how many people are affected? According to the Center of Disease Control, the CDC, roughly 1 million Americans each year are hospitalized with pneumonia. Nearly 50,000 don't survive. Due to the unpredictable and ever-changing flu season, it's estimated that an annual flu-related deaths range anywhere from 3,000 to 49,000. So it's crucial that our patients are introduced to vaccinations to strengthen their immune system and prevent illnesses from occurring.
So how we plan on recruiting patients? In order to find patients, we plan on surveying local pharmacies,